Good afternoon, my dearest grade 12 caregiving. So today I'll be discussing to you the personal protective equipment, which is part of our second module. Okay, so let's start. So the use of PPE provides a physical barrier between microorganisms and the users. So it reduces exposure to risk but does not eliminate infectious hazard. Besides, it does not replace basic infection control measure such as hand hygiene, because hand hygiene is still considered the best way on how to eliminate microorganism in our body, or it is the best infection control universally. Okay, so selection of PPE should be based on risk assessment. So it should be based on the patient or the hazard or the risk of the work that we will be doing. So it doesn't mean that you will just to take the vital signs of the patient, you'll need to have a full gear. But in the case right now that we have a pandemic, it is necessary that we need to have a full personal protective equipment in our healthcare facilities. Okay, PPE should be stored in an appropriate area, free from dampness, sunlight, and dirt, because it may contaminate, or it may the dirt may contaminate this personal protective equipment, as well as sunlight, and the sunlight can lessen the quality, or it can lead to poor quality ng mga personal protective equipment natin. So they need to be examined for the expiry date and checked regularly to ensure integrity. So being a worker in the hospital, it is necessary that you need to check everything that you use, especially personal protective equipment, because this has an expiration date. So summary of recommended PPE usage and standard precaution and transmission-based precaution is attached in your module. So kindly look at it for your for the basis of our lecture. So the first PPE that we will be talking is the use of gloves. So after my discussion, I'll be sending to you, or I'll be giving to you a video clip on how to properly put the gloves. Okay, either clean or sterile gloves. So gloves should be worn when there is an anticipated risk that hands would be contacted with. So if you are anticipating that your hands will be at risk in contaminating infection or microorganism that may lead or that may transfer to another patient or even to yourself, you need to use gloves. Okay? So blood or body, or for example, of these contaminants are blood or body fluids, secretions, excretions, non-intact skin, mucous membrane, and potentially infectious material. Okay, well, who else? Patients who are colonized or infected with pathogen transmitted disease. So, for example, itong dinaranas natin ngayon, what we are suffering right now, which is the coronavirus. Okay? So you need to use gloves for that. Okay? So third is handling or touching visibly or potentially contaminated patient care equipment and environmental surfaces. So use of gloves does not replace the need for hand hygiene. It doesn't mean that you use gloves, you don't need to have your hand hygiene already na. Okay, hand hygiene is still the best way of how we eliminate microorganism in our body, or it will serve as our universal protection against microorganism. So remove gloves after caring for a patient. Do not wear the same pair of gloves for the care of more than one patient. Okay? Please do not use the glove that you have used to clean the wound of the patient 1 to clean the wound of patient 2. Okay? Kasi it will cause cross-contamination. Okay? Tina-transfer natin yung mga microorganism sa patient 1 papunta kay patient 2. Kawawa naman po si patient 2. Okay? So, please minimize it hindi lang siya minimize but it should be avoided. Okay? So, remove gloves promptly after the procedure before touching non-contaminated item and surface. So, immediately, tanggalin mo yung gloves after the procedure na ginawa mo before you touch anything doon sa hospital. Okay? Perform hand hygiene immediately after removal of gloves kasi possibly there are residues of that microorganism, okay, or of that secretions that has a microorganism. Kasi nga hindi natin alam, baka may mga residues or natitira pang mga bacteria or viruses doon sa kamay natin when we do changing diaper or changing linens or changing naglinis tayo or we clean the wound of a patient, so it is necessary that you need to change or do hand washing immediately after using the gloves. Selection of powder-free gloves is recommended since this avoids interaction with alcohol-based hand rub and also the gritty feeling on the hands. Okay? Do not reuse disposable gloves. Okay? Never to reuse it. As what I have said, it will lead to contamination. Then, the sterile gloves should be used for surgical aseptic procedure. So, surgical gloves is only used po sa mga surgical procedures. Like for example, surgery, mga nganak, okay? Pag kailangan po ng aseptic technique, doon po lang tayo gagamit ng surgical gloves because surgical gloves are expensive. Appropriate glove size and type should be readily available. So look for your size. If your size is 6 or 7 or 8, if your size is 8, yung kamay mo, huwag kang gagamit ng 6, baka it will just be broken or masisira lang yan. Okay? Then next, after gloves is gowns. So should be worn to protect skin and clothing during procedures or activities that are likely to generate splashes or sprays of blood, body fluids, excretions, and secretions. Should be worn by staff when applying contact precaution. Okay? If you have contact with the patient, like for example, transferring of the patient from the bed to wheelchair, because there is a direct contact with the patient, you need to always use a gown. Okay? So, next is surgical mask. Okay, surgical mask. So, surgical mask should be worn by all staff. Like for example, ngayon, during pandemic, all of us, even non-hospital workers, will use now masks to protect themselves from contact with infectious material from patient. For example, respiratory secretion and sprays of blood or body fluids. Okay? When engaged in procedure requiring a sterile technique to protect patient from exposure to infectious agent carried in a healthcare worker's mouth or nose. Then, working within 3 feet or 1 meter of patient on droplet precaution. For example, may TB. There is a TB of the patient is diagnosed with tuberculosis. So, you need to have a 1 meter distance between you and the patient because you may acquire the disease through the bacteria. Okay? So, place on coughing patient to limit potential dissemination of infectious respiratory secretion from the patient to others. Okay? Then, always remind the patient and you as well with respiratory hygiene or cough etiquette. So you need to cough with your sleeve, is this with your sleeves, cough in a single-use tissue, make distance when coughing, it should be away from the people. Use single-use tissue and put it to the garbage bin immediately. Do hand washing. Then, yun. Everything. Lahat ng respiratory hygiene. So, next is an N95 respirator. Okay? Should be worn by staff for potential exposure to infectious agent transmitted via airborne route. Okay? Yung mga airborne route. Okay? It is necessary that you need to use N95 mask. Okay? Performing aerosol generating procedure. Like for example, nasopharyngeal aspiration or endotracheal and intubation. Kasi the more na agwaras dejay virus if there is a procedure like that, because the pressure, okay, yung pressure napupunta, lalabas yung mga laman ng lungs natin when there is an intubation. Then there is a possibility that the virus will go to the air and we will breathe. Okay, may isasama yan sa hihinga, may isasama yan sa hangin na lalanghapin natin. Okay? Staff should have fit tests to ensure appropriate respirator selection and use. So you need to know that, okay? In the N95 usage, it is necessary that the healthcare workers should fit the N95 respirator. Nasa ano yan, mga board exam and mga licensure exam, even sa USRN, nandyan yan, yung fit test. Okay, education on respirator use, especially on how to don and doff the specific brand and model of respirator that staff is using. A seal check should be performed by the staff each time when an N95 respirator is done to minimize air leakage around the face piece. Okay? Next is goggles and face shield. Okay, ito yung pinakasikat ngayon sa atin. Diba? It is also required by the government that all passengers now should be used face shield or goggles. Should be worn by staff to protect the mucous membrane of the eye, nose, and mouth during procedure that may generate splashes or spray of blood, body fluids, excretion, and secretion. So personal eyeglasses and contact lenses are not considered an adequate eye protection. Okay? It doesn't mean that you have may adaan chukos mo, hindi ka nagagamit ng goggles or face shield. Okay? Hindi pa rin. May mga ano pa rin yan, leak that that microorganism may enter into your mucous membrane. Kung saan natin makikita yung mga mucous membrane natin? Dito sa mata, we have also dito sa ilong and sa bunganga. And may the microorganism may enter into these areas. Okay? So principles of PPE removal. So doffing of used PPE is a high-risk procedure and requires a strict adherence to PPE doffing procedure to protect healthcare worker from contamination. PPE should be removed before leaving patient care room except respirators, which should be removed after exiting the room. Remove PPE in designated doffing area that prevents other person from getting contaminated. So doon ka lang magtatanggal ng personal protective equipment mo doon sa area kung saan talaga itinalaga na doon magtatanggal ng mga PPE. This is to protect as well your workers, okay, or your co-workers. Okay, perform hand hygiene according to steps of PPE doffing or when hands get contaminated during doffing of PPE. So change PPE and wash skin thoroughly with soap and water without delay whenever having substantial splashing or contamination of blood or body fluids. So disposable PPE should be discarded in lidded waste receptacle properly after use. You need to, yung mga ginagamit natin na disposable gloves, disposable mask, disposable goggles or face shield, it should be always discarded or into the lidded waste receptacle. The reusable PPE should be properly decontaminated after use and maintained. After use and maintained. Okay, what is the suggested sequence of PPE removal? So the first one to take off is remove the gloves, then perform hand hygiene, remove the gown, perform again hand hygiene because you touch the gown. Okay, so you need to perform hand hygiene, remove disposable cup. Okay, then perform again hand hygiene because the one that you use to remove the cup is your hand. Okay, remove eye protection, then perform hand hygiene, remove mask N95 respirator, then perform hand hygiene. Okay, so pero pag nasa ospital ka pa lang, you don't need to remove your N95 respirator. Okay? Special now. That is time of pandemic. Okay? It should always be take off outside the hospital. And palitan muna ng regular pag nasa labas na tayo. Okay? Pero pag wala namang pandemic, we don't use, di ba? Dati naman, we don't use mask. So, pag labas mo, tanggalin mo na yung mask mo. Okay? Outside the hospital. Okay? Respiratory hygiene or cough etiquette, that is already discussed to you when you are in grade 11. So,